Welcome to Ekdantam Dental Clinic. I would brief you about the sterilization protocols we follow at our clinic. We follow the strict protocols as given by Center of Disease Control (CDC). We believe that sterilization is one of the most important things that a dental practice should follow. This term cleanliness is being used as in a different way in a dental clinic and in general practice, because for us a cleanliness, a good hygiene means a proper sterile environment. With sterile, the term, it means that free of microorganisms. So for us, whether it is our instruments or the dental chair or the floor or any surface, even the air and the environment of the clinic should be disinfected. So for instrument sterilization, we follow a lot of things and a lot of steps. First of all, after the use, the instruments are taken into a proper sterilization area. We at Ekdantam have a separate area for instrument sterilization and cleaning. The instrument that is taken is first soaked in a solution of disinfectant for some time, so that all the microbes and dirt particles are removed. After that, the instruments that are soaked are placed into a ultrasonic chamber. This ultrasonic chamber also has a heating unit, so it removes all the blood particles and the dirt that are remaining on the instruments. After this ultrasonic cleaning, the instruments are scrubbed. They are hand scrubbed by our assistant. The assistant scrubs the instrument and makes sure that they are completely free of any particles attached to it. Then they are dried with cloth and by air. After drying of the instruments are properly sealed in pouches. This is a very important thing that we follow, because even after sterilization, if the instruments are not pouch sealed, there are chances that the instrument can get infected again before use in our patients. So the pouches that we use have color coding in it. So this makes sure that while we are sterilizing our instruments, the color of these pouches changes, and this helps us to know that the instrument is properly sterilized. So after the pouches are sealed, the pouches are placed in the autoclave. We use B-class autoclaves that are considered as one of the best autoclaves in their class in the world. After the instruments are autoclaved, they are stored in UV chambers till their further use in the patients. So after the instruments, the most important thing that we believe for a proper sterilization is to disinfect the dental chairs, all the instruments that cannot be sterilized, all the equipments, I would say, that cannot be sterilized, like microscopes, lasers, various surfaces, and the floor. So we use isopropyl alcohol for sterilization for disinfection of all these things. Wherever there is contact of blood, we use a solution of sodium hypochlorite to clean that area. So after each and every patient, the dental chair and the surrounding area is disinfected. We use a lot of sterile disposable things like suction tubes, glasses, bibs, drapes of patient, gloves, masks, and our nurses and assistants are trained enough to change them after every patient. Airborne infections are very common in dental practice. So to make sure that the air in our clinic is pure, we use foggers with solutions that are phenol and quaternary ammonia free disinfectants to sterile the air in our operatory and operation theaters. This makes sure that during our procedures, whether it is a minor procedure like a scaling, root canal, or a surgical procedure for implants or extensive surgeries, there is no airborne infection in our patient. So we have air purifiers with HEPA filter to purify the air of the aerosols and the microbes. Also, we take care of the environment. That waste that is being collected is properly disposed of. At Ekdantam, we follow strict sterilization protocols because for our patients, their health, their well-being and their safety is our priority.